Hi, I'm Joanne West, and I'm a member of the Canadian chapter of T1 International. And today I'm going to talk to you about the insulin access situation here in Canada. I'm going to hide myself and start my presentation now. So, the discovery of insulin in Toronto, the city from which I'm talking to you right now, is a source of pride for all Canadians. We're happy to talk about it. It's on our $100 bill. We're as proud of it as we are of hockey. But here we are in the 100th anniversary of its discovery, and access to affordable insulin within Canada continues to be problematic. It's impaired by cost, issues of inequality, and we are dependent on imports. So today I'm going to talk to you a little bit about how pharmaceutical funding works in Canada, diabetes specifically, and its costs in Canada, what we think needs to change, what we're doing about it, and how you can support us. So let's talk about Pharmacare in Canada. We are the only nation in the world with universal healthcare without universal pharmacare. You might need to read that twice. So contrary to what most people in the world think, and contrary to what most Canadians think, insulin is not free in Canada. Instead, Canada has a patchwork of public and private prescription coverage that varies depending on where you live, how much money you make, and who you work for. So in terms of public prescription coverage in Canada, any medications used in a hospital are covered by the government. So for instance, a diabetic who requires insulin management during a surgery, the insulin used in the hospital stay is covered, but you will not be given any to take home with you. Federal and provincial territorial plans provide some public subsidy for medications used outside of hospital, but only for certain people. Those on social assistance, those over the age of 65, and Indigenous people living on reserve are usually covered. However, there are no national standards for public drug programs in Canada, so that results in a lot of uneven coverage for insulin and other diabetes supplies. Lots of Canadians have private coverage. About half of working age Canadians have employer-based private insurance. Often that requires a copay. However, 1/5 of Canadians pay entirely out of pocket for their prescriptions at a cost estimated to be at today more than $30 billion a year. The patchwork of hundreds of different public plans and thousands of different private ones have left millions of Canadians every year struggling to afford their medication, including insulin. One of the things that we hear a lot is, but it's not as bad as in the United States. And that is true, but Canadians spend a higher percentage of their total health spending on drugs than do Americans. Canadians pay the highest drug costs in the world, behind only the Americans and people in Switzerland. And compared to high-income countries with universal drug coverage, Canadians experience far higher rates of cost-related non-adherence to medications. And we know what that means for diabetics. Our drug prices are 25% higher than the average amongst nations in the Organization for Economic Cooperation and Development. And 1/4 of all Canadian households say they have an individual who did not fill or renew a prescription or who rationed a prescription because of cost. And the reality is this results in hundreds of premature deaths annually relative to comparable countries that have universal drug coverage. We do have something that our American cousins don't, and that is the Patent Medicine Price Review Board, which is a quasi-governmental organization that sets price ceilings for drugs that newly enter the Canadian market based on cost of those same drugs in comparator countries. A couple of problems. The board only regulates the price that is charged wholesalers or hospitals or pharmacies, not the end user prices. And those include markups that make it more difficult for Canadians to pay for their drugs. And existing drug prices are almost never reviewed. So all of the insulins that Canadians currently use, their price is already set, and there is no instance under which they have been reviewed to date. So let's talk about diabetes in Canada. Diabetes affects more than 3 million Canadians. That's one of the highest prevalence rates amongst comparator countries. For context, we have about 36, 37 million Canadians in total. So as in many other places in the world, people who live in Canada that have low incomes and diabetes have to make some terrible choices about how to best manage their condition. And it should be noted that Indigenous peoples who live in Canada are 3 to 5 times higher risk of developing diabetes and have far higher rates of complications. We also don't make any insulin in Canada. So Connaught Labs, which is affiliated with the University of Toronto, were the world's original insulin producers. They accepted that famous $1 patent from Banting et al. And they later entered into agreement with Eli Lilly, who initially did mass-produce insulin here in Canada. However, our conservative government sold off Connaught Labs in 1984, and that's when any domestic manufacturing of insulin in Canada ceased. Today, we truck it all in from America. So when people ask you whether Canadian insulin is safe, the answer is yes, because it is in fact American-produced insulin. The financial burden of diabetes in Canada. So at a national level, way back in 2015, it was estimated that there are 3 billion annual direct costs to Canada related to diabetes care, and that in just a few years, that direct cost will have increased by over 40%. We are in the top 10 OECD countries for both total and mean healthcare expenditure related to diabetes and its complications. We're very lucky. Visits to physicians, specialists like endocrinologists, hospitalization, and most lab and other diagnostic tests are covered in all jurisdictions. But most Canadians with diabetes pay more than 3% of their income for medication each year, and supplies and other diabetes management devices, etc. And that is defined as a catastrophic level of cost by the Commissions on Healthcare. There are some Canadians in Canada that spend more than $15,000 a year on insulin and medication and supplies and devices. I'm one of them. So at the individual level, a quarter of all Canadians with diabetes report that costs affect adherence to treatment. In a survey done by T1 International, they found that about 1 in 5 Canadians have rationed their insulin in the last year. The inequitable pattern of access to affordable insulin and other diabetes management necessities depends very much on what jurisdiction you live in and the will of the government in that jurisdiction. We've seen expansion and contractions of coverages at different jurisdictions within Canada. So in some provinces, only children and seniors can access government assistance in paying for insulin and other supplies. I will say that the Yukon Territory is the only part of Canada in which insulin is free to anyone who needs it. So we have 3 main issues here in Canada: no universal pharmacare, which results in an inequitable cost burden in accessing insulin and diabetes supplies and results in rationing. We have a patchwork of access that disproportionately impacts the most vulnerable, and we have no domestic manufacturing. We need universal pharmacare. With a national system of pharmaceutical coverage publicly funded in Canada, the federal government would be in a position to save billions of dollars and drive down cost. And by removing out-of-pocket expenses for insulin and other diabetes supplies, we would improve patient adherence and outcomes. We would reduce avoidable hospital admissions. We would avoid complications and premature death. And there would be a net savings to the public in general. Why hasn't that happened? It's so obvious. The pharmaceutical industry has been effective in lobbying within Canada against universal pharmacare. And unfortunately, the dominant diabetes organizations in Canada are compromised through their relationships with the pharmaceutical industry. There are shared health responsibilities between our federal government and our provinces and territories, and that allows for infighting and avoidance of bringing in what would be a complicated system, but one that would, as I've said, save the country billions of dollars every year. And frankly, Canadians haven't demanded it. We have put up with governments, subsequent national governments promising to provide universal health care, not doing so, and to date, we haven't voted them out because of it, although we are in the midst of a federal election just now. So let's see. We are advocating for free insulin for everyone in Canada who needs it, coast to coast, regardless of age, income, etc. So a minimum improvement would be to make all kinds of insulin free. In addition, we are also advocating that other medications, devices, supplies that help people to manage their diabetes and avoid complications or manage those complications, they should be broadly and consistently available across Canada, regardless of where you live. So the mission of our chapter has been to raise awareness within Canada, and today we have the opportunity to raise awareness outside of Canada about issues in accessing insulin, about choices that Canadians who need insulin are having to make, hard choices, unacceptable choices. We try to educate the public about the issues that we face. We try to elevate the voices of people who need insulin and manage diabetes within Canada. And we advocate with all levels of government for the legislative change that we need to best support Canadians with diabetes, specifically universal pharmacare and equitable access. So here's some of what we've done so far. We provided testimony to the Canadian Senate regarding a national strategy for the monitoring care of diabetes in Canada. We created a letter writing campaign in response to recent news that animal insulin would no longer be imported to Canada. This would impact about 400 long-term diabetics who have been living with this disability for probably more than 50 years and whose bodies just do better with animal insulin. That fight is not over. We're still in the midst of it. We sent a written response, and I was lucky enough to go to our national capital, Ottawa, to attend a meeting regarding the revision of guidelines around pricing for new drugs that would enter our Canadian market. Those guidelines remain under review, despite originally they were supposed to have been implemented, gosh, I think it's 2 years ago now, but the pharmaceutical industry has been successful in delaying that out of fear that it would, I guess, adversely impact their bottom line. We have, our members have activated direct mailing campaigns in support of universal pharmacare during our last federal election, which was only about 2 years ago. And we are doing so again. We have run several social media campaigns in support of universal pharmacare. We've also run them in support of access to diabetes technology, to have national parity about that access. Currently, we're supporting another organization's advocacy online around coverage for continuous glucose monitors and continuous coverage in Ontario for annual diabetes eye exams that used to be publicly funded, but in the last few months, the public funding has ended. And we know that if people have to pay out of pocket, that will disproportionately adversely impact people who are the least able to pay out of pocket. For the 100th anniversary of the discovery of insulin, our chapter had originally planned to have lots of lovely direct action events at the site where the conference marking the 100th anniversary was going to be held. It would be a medical conference with endocrinologists and diabetes researchers from around the world that would be meeting near the site where the discovery of insulin took place. Obviously, they and we had to shift to online because of COVID. But we used the hashtag #FreeInsulin100 and generated advocacy and awareness. We continue to take meetings and build alliances with national, provincial, and international organizations who share our goal of universal pharmacare within Canada. And only, of course, those organizations that are non-pharma industry funded. And we're very grateful today to talk to our friends around the world within T1 International who understand the challenges that we all face as people who need insulin to live. We're heartened by your energies and your fights, and we continue to want to build alliances with other chapters. We've had some great conversations with some American chapters. Our closest cousins in the New York chapter have been wonderful to us. And we hope that you will help to elevate our messages. And we want to be really useful to you and elevate your messages and support you in your advocacy. So here are some of the ways to follow what we're up to and to get in touch. We want to end by acknowledging our privileges here in Canada. We live in a peaceful country. We have a stable government. We have a public healthcare system, even though our prescription needs are not covered. We live on ceded and unceded Indigenous lands. And it is a reality that 2/3 of working Canadians have access to employment-based health benefits, but we have not achieved our goals. There are many people in Canada who need insulin, who can't access it without rationing, who are paying catastrophic healthcare costs. And we are not giving up until we change that reality. We're very proud of the work that we've done so far. And we're really grateful for the chance to talk to you about what we've been up to. Thank you so much for listening.